Hello everyone, hope you're doing well. Today, let's talk about something that affects a lot of children worldwide, acute lymphoblastic leukemia, or ALL. This is the most common type of leukemia in children and teenagers, but it can also affect adults. While rare, it's a condition that can progress quickly if not caught in time. So, what are the early warning signs of ALL? Could you or someone you know be at risk? Let's break it down. ALL is a type of blood cancer that affects the white blood cells, which are responsible for fighting infections. In ALL, the body starts producing too many immature white blood cells called lymphoblasts, which crowd out healthy blood cells. This leads to a weakened immune system and serious complications if left untreated. Leukemia doesn't always start with obvious symptoms, and that's what makes it dangerous. However, there are some early signs to watch out for, such as unexplained bruising or bleeding, where bruises appear in unusual places or small cuts take longer to stop bleeding. Extreme fatigue and weakness is another red flag, where a person feels unusually tired no matter how much rest they get. Frequent fevers and infections become common as the immune system weakens. Many people also experience bone and joint pain, often feeling aches in their legs or arms. Pale skin and dizziness can be signs of low red blood cell counts, anemia, and some people notice swollen lymph nodes, liver or spleen, with lumps in the neck, armpits or groin. Shortness of breath can also occur when leukemia cells affect oxygen levels in the blood. If these symptoms last for weeks or get worse, it's time to see a doctor. A simple blood test could make all the difference. Certain groups of people are at a higher risk for ALL. It is most common in children under 5 years old, though it can occur at any age. Teens and young adults are also affected, though it is less common in people over 40. Studies show that males are slightly more likely to be diagnosed than females. People with genetic disorders like Down syndrome are at an increased risk. Additionally, those exposed to high levels of radiation or toxic chemicals like benzene may also develop leukemia. Globally, about 6,000 new cases of all are diagnosed in the US every year, and around 80% of childhood leukemia cases are ALL. If doctors suspect leukemia, they start with simple blood tests to check for abnormal white blood cells. If results are concerning, further tests include bone marrow biopsy, where a sample is taken from the hip bone to look for leukemia cells. Lumbar puncture, spinal tap, helps determine if the cancer has spread to the brain or spinal cord. Genetic testing is also done to help doctors determine the best treatment plan based on leukemia type. Early detection is key. The sooner leukemia is diagnosed, the better the chances of successful treatment. The good news is that ALL is highly treatable, especially in children. Treatment usually involves chemotherapy, which is the main method used to kill leukemia cells. Targeted therapy is a newer treatment that attacks only the leukemia cells without harming normal ones. Steroids and supportive care help manage side effects and strengthen the immune system. For severe cases, a bone marrow transplant may be required to replace diseased bone marrow with healthy cells. Thanks to advancements in medicine, survival rates for childhood all have improved dramatically, with about an 85 to 90% cure rate in children. However, for adults, the outcome depends on how aggressive the leukemia is and how early it is diagnosed. ALL is a serious but treatable disease if caught in time. If you or someone you know has unexplained bruises, constant fatigue, or recurring infections, don't ignore it. Get checked. A simple blood test could save a life. Want to see realistic, animated medical cases of leukemia and other serious conditions? Check out our animated medical series where we bring true ER cases to life. For more information, visit our blog at the link given below and watch our animated medical series here in this YouTube channel. If you found this information helpful, don't forget to like this video to spread awareness, subscribe for more life-saving health insights, and share this video with family and friends. It could save a life. Early detection is everything. Stay informed, stay safe.